Hey everyone, I've got something to say again about COVID, so I'm going to talk about the data. But I'm going to show you how the data compares to some of the news headlines I've been seeing lately. I've got 3 news headlines that I want to push back against with the data. I'm going to consider them to be badly written, at least in some way. And I've got 3 news headlines that you may not have heard of. And I want you to make sure that you know these. I'm going to go through these quickly. And so just to jump right to it, let's talk about the 3 bad headlines first. To give you some context, I've been running this for several months now, and I want to go back a couple of weeks to say what we've been talking about. A couple weeks ago, it was looking like Arizona was starting to be a hot spot. Texas and North Carolina were also singled out as potential hot spots. Those happened, and in fact, right now we're in the middle of a hot spot for Arizona and Texas. What does that mean for the country as a whole is the question that I want to get at in this. The other thing is that I've talked a lot about Florida. I even had a podcast titled Stop Picking on Florida. And I still want to say stop picking on Florida. There's nothing going on with Florida that I don't see going on with other states in greater detail, mostly in other states. Florida, I was saying that people were talking about it spiking. I was saying I don't see a spike. And now people are talking about it spiking again. Now I see a spike, but I see a spike in cases, but not in hospitalizations. So I'm going to go forward and talk about that. That's the context for Florida. Also, I've talked about California before. California is such a big state, it would be really nice to have Northern and Southern California and Central Valley California to be able to compare. When you're comparing things state by state, you've always got to remember that California is big in space and big in population. And that means it's very diverse as well. So beware of drawing conclusions. They've also had difficulties reporting their data, probably because they're so big. And I want to say, so these things have happened, and now we've got headlines about Arizona and Texas in particular. Now that everyone's reporting on this and caught up, let's look forward a little bit more and say, okay, we're worried. Now how worried should we be going forward? So that's what I want to comment on. So we've got 3 bad headlines. To start with the bad ones, I'm going to say once again, this is not a second wave. Florida is not yet facing a disaster, and California hospitalizations are not at a peak. They are actually down from the previous peak, although they're up a little again. So don't take my word for it. Let me show you the graphs. Here's a headline, and I actually had this one previously where I talked about a second virus wave. I think that this meme has passed. Most people are now pushing back against this. A bunch of scientists said, no, we're still in the middle of the first wave. It's just geographically dispersed. We had a wave in New York, we had a wave in Washington, and now we have a wave in Texas and Florida, the South and the Southwest. So there are rises, they sound alarms, but I do like the subheadline for this. Experts say that surges can't be linked directly to reopenings. Good. So I'm going to show you the data that is most important for putting this into context. Currently hospitalized by region, and look at all these different regions. Mid-Atlantic had a huge peak of 30,000 hospitalized residents at peak. Nothing else is above 10,000 right now. We have other regions that are now around 6,000 per region if we move to the right side of the graph. But I want you to note how much better it is now than it was a month or 2 ago. There's no question that we're doing okay now. The question is, with these local outbreaks that we're seeing in Arizona and Texas, are we worried that someday they'll pop up like the Mid-Atlantic? And they are going up. So if you zoom in on those other ones, you can see south, southwest, and west are either holding steady or going up. And the southwest in particular has really started to do what I would call a genuine widespread spike. Some kind of outbreak going on here. You can see this. Just want to remind you, this is a spike up to 6,000 hospitalized out of a context of one corner of the country that is not doing well. So let's take a closer look and wonder, why do these states, especially Texas and Arizona and then California, what do they have in common? Well, I pulled this from the C19 Pro website, which I'll tell you a little bit more about in a second. But it's a global indication of the slopes of death rates from COVID-19. If you look on this graph, actually where it's blue, things are getting better. Death rates are going down. Where it's red, death rates are going up. And look at the biggest contrast on this whole map. The U.S. is blue, light blue, but still blue. Mexico is red. So right at the interface between the two, you have the biggest disjunct between rising death rates and falling death rates when you measure it by nation. So it makes sense to me that the states along this border, the border is closed, but it's open to certain kinds of travel. At least when I looked at it a couple weeks ago, it was sort of complicated, but if you're a citizen, you could still cross to, say, get medical care. And so you do have some epidemiological spillage of the outbreak that's going on in Mexico right now, north of the border, to the hospitals in the U.S. And so that's what I would say bad headline number one. Not a second wave, but a continuance of the first wave. Bad headline number two is this one. New York reaches a good coronavirus landmark as parts of red America are facing a potential disaster. Okay, let's see how disastrous this disaster is. And this is the thing that caught my eye, because I've been watching the Florida numbers. I know what the Florida numbers are. And back when this came out on Friday, it had this text. In Florida, 12,000 people are hospitalized, compared to 8,500 people a month ago. That's an increase of 4,000 in a month, the way they reported it. Well, I immediately knew that was wrong, because they had looked at the covidtracking.com site, and they had looked at the wrong column. They looked at cumulative hospitalizations, not current. Florida does not report current hospitalizations, which kind of annoys me, but the fact of the matter is, this is cumulative. And so notice that they made a little change, and they have a previous version of this piece. They fixed it. I don't know if they saw my indignant tweet about it or not, but now I can still be indignant because I screen captured what the original thing was, and it was still 24 hours after it was released, so it was a little while. It wasn't like they went right back on it. In Florida, 12,673 people have been hospitalized. Have been, compared with a cumulative total of 8,000. They got it right, and they caught their mistake. Good for them. But for all the people that read it, when I read it, you would get the entirely wrong impression. Now, that doesn't take away from the rest of the data reporting here. Arizona and Texas do have genuine spikes both in cases and in hospitalizations. But is Florida facing a spike in hospitalizations? They've gone up. Well, they've got to go up. It's a positive number. Things happen over time, so you've got to have a positive number. You can't erase the past. Okay, so what's happening in Florida? Well, new hospital admits, here's a graph of it, and I've taken the data. This is where I know the numbers from. And you see that it was up around 1,200 per week, and then it dipped down to about 800 per week. So it went from 1,200 to 800, sort of a 33% drop there. And now it's gone back up to about 1,100 again. So it's back to where it was before. It peaked actually at 1,400. So we are still 300 per week away from the previous peak. I don't like being back where we were a month ago, but the fact of the matter is, when new hospitalizations happen, they're happening at the same rate they were a month ago, and they're happening at roughly the same rate they've been happening for the past 2 or 3 months. That's not to say they won't spike. The other thing is that these are new hospitalizations, so if these people are staying in the hospital longer, then this could be a problem. But all reports are that these are younger people who are staying in the hospital less time on average. So it seems to say that Florida has capacity to face this. And if you look at the shape of that curve, it's kind of going up steadily, but it is not scooping up exponentially. And at least there's that. So what I'm going to say is in Florida, this does not look like potential disaster to me, any more than any state facing an outbreak has potential disaster. I mean, we don't really know. Other states have gotten through things like this okay. So I want to point out that this level on the right is the same as that level a month ago on the left. Bad headline number 3. I saw this one this morning. This probably prompted me to do this. Hospitalizations hit all-time high in California. You see, what troubled me about this is because I've been tracking these hospitalizations, and I can tell you, they weren't at an all-time high yesterday, so I'm like, did they spike up or something like that? And this is a big headline tweeted out by San Francisco Gate, a major newspaper. And so this is the graph I've been looking at. Once again, this is a great resource to go at, and you can look at the purple line, currently hospitalized, Looking at that line, you see that, okay, they are going up. Over the past week or so, they have been scooping up a little bit. Before that, they had been roughly going down. And so the peak that we have reported is about 5,200, and I'm not entirely sure that's the true peak because that data looks awfully weird when you get to the left of 5,200. Whatever it is, it's definitely gone up, but it's not higher than ever. In fact, it's only as high as it's been a month ago. So again, we're back to where we were a month ago. It'd be nice to make some progress in a big state like California, especially right next to a hot spot in Mexico. That's what I would put forward as the result for this. So all I've got to say is, yeah, it's going up. These are not lies. This is not fake news, but it's a bad headline. Okay? I think that the reporter in this case was also possibly mixing up. California has a substantial number of probable COVID cases as opposed to confirmed COVID cases in the hospital. And I think the reporter was using the confirmed cases when the probable cases should be added in as they are on this. You've got to be sure that you're comparing things the same way as you're going along. And so this is, I hope this goes down soon. Again, does not look like a potential disaster. Look at the deaths line. The deaths line is steadily going down still. So at the end of the New Yorker article, they have this thing that these numbers are still relatively small compared to what was experienced in the Northeast, like I just showed you. But the nature of a pandemic is that when it gets going, it can spread very rapidly, exponential growth. And I'm scared of that too. So I want to see if there's any signs that exponential growth is around the corner. So the thing is, what did the data modelers say? Before I've shown the IHME modeling site, but I've actually, I've criticized that in some ways, and I'm tired of them actually. It looks like they are actually in with the press. They've pushed their model to the press. But there's a lot of other good modelers out there. So I went around and I looked for another good data modeler, and I found one that I really like, and this is the C19 Pro is the way that they do this. Yu Yang Gu and a lab. He's somehow associated with MIT Data Analytics. And so all I know is when I look at this model, the model fits what I've seen and my intuition from looking at the data for a long time. I've been looking at this data for 2 or 3 months now. And this modeling seems to be the kind of model that I would do if I was a data modeler. The other thing that they do is they actually go back and check to see how good was their model and how can we improve it going forward. So actually checking the models. Who watches the watchmen, right? Who models the modelers? Well, this site does. And they try to use that for their machine learning. So this is my personality pushes me toward this. There might be others that other people like more. Okay, the best thing to do is to put them all in a room. But let me tell you what this modeler says. Are we around the corner from an exponential increase in cases in Arizona? And so another thing that I like about this is I've seen that there's this lag between cases and deaths that seems to be increasing over time. And explicitly on June 19, Dr. Gu showed that this was accounted for. He accounted for this in the data model that we have now. And it actually brought the deaths down. I've seen the deaths are going down faster than I expected. So with all that said, that's why I chose this model. Feel free to choose your own model on your own indications, but what does this one say? This one shows that United States deaths are down, but it shows that they might go up slightly. Error bars here are pretty big, but this is what the model shows right now. It shows that they might go back up to 1,000 deaths a day. Right now we're down around 600 deaths a day. And so they predict they predict that the epidemic will be ongoing. And this is, technically, is this a second wave? I don't think so. I think it's still part of the first wave. Big country, diverse country, you've got a lot of space for the virus to spread through, and a lot of policies that are more or less successful for the virus to spread through. So if you look at this, you can see that the United States is shown as being 5% infected right now, which is interesting. Discussions about that. But this fits with what it looks like the deaths are doing, and it fits with what the cases are doing. It's a shame it's not going down, but it's also not exponentially going up. We know how to treat this disease better, and this model could account for that. So C19 Pro is predicting that there is going to be a coming plateau of cases, here's the case prediction, and you see that there's sort of a plateau around 50% of the peak. And the plateau of deaths is around 25% of the peak in deaths. So if this happens, then I will know that looking forward, this model will be the good one. But this is sort of my intuition for what's going on right now. Realize that that means a lot more cases. Cases might be flat for a while. But that does not necessarily spell disaster, okay? I want to try to take this with the right grain of salt, and it's like, what do we do with this? So what does it say about Arizona? I love this site actually because it also even has King County for my own experience looking at that for so long. Here's what it's showing for Arizona, and it's showing that deaths are predicted to go up, cases are predicted to go up, maybe through early July. But then it predicts that they will start going down. Okay, let's keep an eye on it, and let's see what happens. This model at least does not predict disaster for Arizona, although the cases going up and hospitalizations going up and deaths going up may mean that Arizona has to impose some restrictions now that it didn't have before. Definitely, at the very least, wear masks. It's so easy, and you might feel a little silly doing it, but that's, like I've said before, masks make a whole lot of sense to me. A lot better than locking down the entire region and locking everyone in their homes. Okay? So Arizona will get worse before it gets better, but I'm hoping it will get better starting at the end of July, and we'll see what happens. So those are the bad headlines that you didn't hear, that you may have heard, because everybody hears the bad headlines, it seems. Here are 3 good headlines that you may not have heard of. First of all, I've said that the Northeast is doing really well. And the good headline you don't hear, I was surprised to hear this, they are closing COVID units. Now, I don't exactly know how I'm sure they're closing the unit and opening up something else, but whatever it is still good news, and it's an indication that there are fewer COVID patients in the hospitals. We know there's fewer deaths, we know there's fewer hospitalizations. That's allowing the hospitals to reconfigure to allow for this new normal, which means less COVID, okay? Where is Washington relative to this? California, Arizona? I don't really know, but the modelers might be able to give us a clue that someday we will get to this stage. So Connecticut is there, and definitely things are looking better. No reason to stop wearing masks now, but there are some other things that possibly can be relaxed based on that. Good headline number 2. I've been keeping a close eye on the particular states where I know there were big protests. I have not seen a single state that has an undoubted increase in hospitalizations that must be due to protests. Some states are increasing in cases, but the real way to test this is to test the protesters. And I just found this article from Wired, and you need to know about this. They talked about 3 different areas where they had large protests, where they specifically tested protesters after the protests, after a certain week-long incubation period. If they were going to get it, they were going to get it by now. And so they found about 1% of the protesters tested positive. Well, if you took a random sample of people, at least in Minnesota I heard this, 1% of them would test positive. So it seems that there's no increased risk from the protesting. Like I said, there's things that are more important than lockdown and than staying inside. And so this was a physical way that people were able to be outside, and the good news is it did not start a wave, even if it was percolating and coming up above the surface. I would expect that you wouldn't be able to find consistent results like this. So it's actually looking okay. It looks like that kind of relaxation of quarantine didn't have a big effect. Good headline number 3, and this is another drug that came through. Again, you hear about these a lot, but this one looks especially good to me because number 1, it's cheap and common. It's dexamethasone, and it is something that I might even have some in my house for treating my kids' asthma. I don't know. But it's a steroid that affects the lungs, and so they were trying it, and doctors noticed anecdotally it seemed to help, so they did a randomized trial where the way they did this trial was also really cool. They randomized it, and they did it as efficiently as possible, which gives me a lot of hope that other things can be tried out this way. And they got this result. This was for the ventilated patients This was for the red line. You can see the line goes up when a patient dies. And so you can see that the usual care, the black line, just went up and up like that. With the red line, when they added in the dexamethasone, it went up less. And so that was a significant increase in mortality. That curve looks significant to me. By their stats, it does also look significant. There's still a lot of things. These are complex things, and there's still a lot of hoops to jump through. But this looks as good as any graph I've seen like this. This looks really good, and more like this should be being tested now. To me, this is one of the reasons why that death line might be coming down so much faster than the cases line. And I want to keep our eye on this. We're not staying the same. We're running to fight against this, and we're trying different things. Some things are working. And so, don't start taking this yourself. But we've got a good-looking clinical trial, and it looks like this will treat severe cases of the disease rather well. So once again, we have the 3 bad headlines, the 3 good headlines, and that is what I want to end. I want to end this on a good note with that. Thanks for listening. We'll keep watching the data, and I will get back to you in about a week or so to see what new headlines we have. Hopefully there will be some more good ones and fewer bad ones. All right, see you then.